Thank you, Sue, for being here. And thank you, everybody, for coming. A few hours ago, I was in another country, in a completely different place than here. But the trip was as if it did not exist at all. I was dreaming I was already here. So it's very nice to see you. I don't know what I'm talking about, frankly, but what I will talk to you about. I have all prepared some things. I brought my thesis, which is on epilepsy and drama therapy. I brought the book where I have written the chapter on Metamyth, which is a method that is based on mythology and drama therapy. And touches on the humanistic psychotherapies and existential psychotherapies. I have also brought something which we can finally use. Because of the previous talks, I was inspired, and I'm glad I haven't really prepared something. So taking from the others and the audience, we will create together this presentation. I was very much intrigued with what Sue was saying about the difference of the medical and the shamanistic way of seeing a patient or a condition, a medical condition. And actually, this is what my journey was from the beginning. It still is. I came across to epilepsy because I was working as a manager in one of the consulting rooms of doctors. And so I was meeting a lot of people who had epilepsy and their families. At the same time, I was training as an actress. My job was a job which was very interesting, but little by little I had become so involved and finally so concerned about what was going on and what the people were telling me. And I found myself in a position I never expected, like I was acting as a counselor before they would see the doctor and even after. So I kind of made it up in my mind that there isn't just the medical examination. There's more that the patients need. This is when I decided I was going to take this route and become somebody who could really help in a responsible way this particular problem. There was a need to talk more about their personal circumstances and their feelings. And I was wondering why the doctors really did not kind of fulfill this need, but it was very obvious that they didn't. And in a friendly way, I have decided I was going to kind of bring in the two sides together. And being a Greek woman and having grown up in the Greek tradition with the ancient Greek theaters, where I grew up watching these ancient Greek plays, all these kind of energies were kind of overwhelming me, and there was this constant association with what was happening to me, what I was going to do, wanting to do, the healing side that I wanted to follow, and the ancient Greek play The Bacchae by Euripides. I found a tremendous, and this, what I'm telling you now, they are forces. It's it's not so simple. I was living the medical side where I was supposed to help, but I was realizing that there's something not quite done, and I took the responsibility to do it, and at the same time I was kind of referring myself to an archetypal situation where the two differences, the two different poles, like Pentheus, who is the logic and the reason, and Dionysus, who is the instinct and potentially the divinity, are in complete contrast. They have very kind of interesting dialogues between each other. They get angry. And finally, as the play goes, well, in Dionysus in the first place, he was outcasted from Thebes, so this is why he got angry in the first place. Then he approached Pentheus. They started the dialogue, but Pentheus was impossible to understand and to come into a communication. And then Dionysus was very angry, and he took the Maenads up to the mountains, where they behaved in a way that Pentheus would not agree at all. Finally, his mother, who was one of the Maenads, went with Dionysus up the mountains. She, in a trance, she pulled off his head, her son's head, and this is how the play ends. Now, there are, as in every Greek play, there are so many things that one can find to associate with or to make any kind of references. But it's, to me, at the time when I was living, this this situation with the healing side, the need for the psychological support, and pure science, this play was in my mind. I think it's kind of expected that when I developed my technique, which is Metamyth, mythology was a big part of it, and now I'm used to, in any case, in any problem, that I get this kind of leap to the archetypal, and it's very rewarding. It kind of opens up a world where things can be very small and very personal, but also this reference to something that's archetypal can be comforting and relieving. Now, I had continued with looking at epilepsy, and I have read a lot, and the more I read, and the more people I met with this condition, the more I wanted to kind of find out what was happening, and I kind of came across the social history of epilepsy, which is very old. It is always associated with medicine, but at the time when this condition was described, the medicine was only shamanic, and there was no science. So the first scientist, apparently, who had come up to say that epilepsy isn't something that has to do with demons, was Hippocrates, who called it the sacred disease, and who said that it is a physical condition. It is a condition of the mind, and it does not refer to any kind of magic. After after him, there were about 2,000 years of misleading circumstances, where, as if he hadn't said anything, I mean, nobody had kind of went back to what he had said. They kind of follows completely. This is what really fascinates me, that it really follows the social history of the world. Like, however the world behaves, this is the assumption and the theory they develop about epilepsy. So it started again becoming a science when the microscope was invented, and when there were more specific studies in biology. But it's very strange that recently, still now, there are places in the world where, in my books, this is very detailed. I might have to open one of them to tell you precisely what's happening, because, like, let's say until the 50s, the people who have epilepsy were not allowed to get married. Or in some places, the women were, what's it called when you cannot have children?
Sterilized.
Yes, they were sterilized, the women who had epilepsy. And very recently the laws were passed where they could, people who have epilepsy could drive, or still they cannot drive, but there was a debate at a certain time, they cannot. The employment law is very difficult for these people, and certainly there is a lot of stigma, social stigma, which apparently creates feelings to the people who receive it, and also to the people who are practicing it. So, as therapists, we look into both sides. It's not only the person who receives it so badly, and they might suffer, or they might, in a reactionary way, behave in a way where they would be considered having some kind of disturbance, a psychological disturbance, or simple things. They could have depression, or they could have personality disorders, or but also the people or the groups who practice stigmatizing people with epilepsy or anything else, they also need some kind of care, discussion.